Okay, Katie. I'm going to go ahead and put gloves on and take a look at your back. Since you mentioned that you were having a lot of soreness around the spine, I'm going to definitely pay more attention to the muscles. Looking for any pulsations, any rapid movements, something that would indicate maybe a nerve disorder. Also, some discolorations I'm noticing could be caused by a lack of oxygen to the fibers. I'm going to tap around the spine. We're testing spine mobility. I'm noticing a little bit of inflammation around T3. So definitely we're going to focus on the thoracic area to increase circulation. Checking scapula mobility now on the right side. Going to take a few measurements here. I'm going to clean the area first. Then we'll take a few samples. We're also looking for elevations. So anything that comes into surface with the probe, we're going to be able to send it to the lab. And sometimes these cells might cause some numbness around the area, so I want to make sure that everything looks good. I'm going to touch you with two textures. One is going to feel dull.
Okay.
This is what dull is going to feel like. And the other one is going to be sharp. Something like this. So go ahead and tell me if it feels sharp or dull for you.
Sharp. Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull.
Okay. Looks normal. Now can you please tell me if you feel this on the left or right?
Left. Left. Right. Right. Both. Both. Left. Right. Left. Left. Right. 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 I love.
Good. Going to go ahead and apply an anti-inflammatory infused oil. It helps with inflammation and pain. You might feel like a warm sensation right when we apply it. I'm going to apply it all over your back. And we're going to start with cupping therapy. we're focusing on the paraspinal muscles. Trying to decrease inflammation and increasing circulation in these areas. It's going to help with the sore muscles and to decrease pain, stiffness. Okay, I'm going to go ahead and remove the cups. I definitely want to make sure that we are removing them properly. I'm going to go ahead and use cold therapy to massage the areas that we are targeting. is going to feel a little bit cold. I'm going to apply acupressure therapy to activate the main organs. This will help to release hormones that help to regulate the body heat. It releases heat, and that usually helps with muscle movement. I'm gonna have you get dressed, and we can go ahead and schedule another session for the next 2 weeks.
Very good.
Hi, Anais. My name is Dr. Mad. I'm going to do your exam today. Can you please verify your date of birth?
06/01/1992.
Okay. Before we begin and start with the medical records to see what we can discover, do you have any allergies to medications?
No.
Okay, that's good. So in case we do prescribe something. Okay. And is there anything in particular that is bothering you today?
I've noticed I do get bruised kind of easily, and lately I've had some trouble concentrating and doing like one thing at a time. I'll start to do something, and then my mind just kind of goes all over the place.
Okay. And for how long have you been noticed bruising?
About a few weeks, maybe like the past 3 weeks.
Okay. And is it generalized or it's in a particular spot?
Very, very like generalized, I think.
Okay. All right. Any pain?
No, not really.
And when you say concentrating, how difficult it is to do your work, for example?
I'd say maybe like it's pretty challenging. I'll start and then I'll listen to something or I get a notification on my phone and then I like forget what I was doing.
Okay. And for how long have you been experiencing this?
I think noticeably like the past couple of months.
Okay. Any recent events that could have triggered this?
Maybe the change of job.
Okay. All right. Any palpitations or difficulty breathing?
Sometimes when I sleep, but not that much.
Okay. I'm going to take your temperature. Have you noticed any flu-like symptoms in the last 48 hours?
I have a little bit of a sinus.
Okay. 98.2. Perfect. I'm going to wrap this around your upper arm here. Okay, do you have hypertension in the family?
No.
Okay. This is going to feel a little bit cold. I'm going to put it right here under the cuff. All right, no high blood pressure. I'm going to go ahead and slide this down. I'm going to check your pulses now. So I'm going to use 2 fingers and just put them around your wrist. I'm going to have you breathe normal as well. I'm going to go ahead and compare. I want to make sure that your heart functions properly before we do anything else and that we're ruling out something more serious. Very good. So 2 plus there. I'm going to go ahead and take a look inside your ears. I'm not noticing any cerebrospinal fluid. Okay. Get a little bit of redness on this side, but no signs of infection. I'm going to take a look inside your mouth, so we're looking for any swelling. Go ahead and give me a big ow. Go. No swelling, no redness. Can you move your tongue up and down for me? And side to side. Go ahead and give me a big smile. Okay, everything looks symmetric. Go ahead and frown with your eyebrows. Good. And try to lift your eyebrows up. Very good. Now I'm going to try to move your head towards the right side. Don't let me do that, okay? Good. And the same thing on the other side. Don't let me do that. Perfect. I'm going to put my hands on your shoulders as well. I'm going to have you shrug your shoulders. Very good. And now go ahead and extend your arms for me. I'm going to try to press them down. Don't let me do that. Good. Good. Now go ahead and squeeze my fingers. Okay. Very good. Strong and symmetric there. I'm going to check your reflexes. So as you can tell, we're doing also a cranial nerve exam. I want to make sure that all 12 nerves are intact. Okay, I'm going to have you relax your arm. Good. Good. Perfect. So I'm not noticing any sluggishness, impaired sensory stimulation. Okay. Okay, go ahead and relax your arm again. Perfect. Good. I'm going to check your patellar reflexes now. Good. Okay, perfect. All right. Okay. Now we're going to do olfactory nerve. Are you comfortable?
Yes.
Perfect. On a scale of 0 to 10, how would you rate your pain right now?
Oh, like a 6.
6. Okay. So I'm going to be looking for bruising as well around the scalp area and face. Try to listen to your heart first. like sinuses. Submental lymph nodes. Non-palpable. Okay, I'm going to check it for color deficiency. I'm going to ask you to open your eyes. Perfect. And can you please tell me what color you see here?
Green.
And what about here?
Purple.
And
Pink. Blue. Yellow.
I'm going to ask you to keep your eyes open just for another minute, and then I'll have you close them again so that you can fully relax. I'm going to show you a few pictures. Just try to interpret them on your own.
A spaceship.
Okay.
Scarf. Teeth. Peanut. An eye. Hockey stick and puck. Leaf.
Okay. So this is more to assess for ADHD and to see exactly how your brain perceives different realities. Now here I have a few pictures, and these are real people, so if you can please describe it in just a few words what you see.
Family jumping.
Okay.
People brushing their teeth. Kids running. A girl whispering to her dad. Friends talking. And a dad playing with his baby.
Okay. Alright, I'm gonna have you close your eyes now. Going to test your sense of taste. I'm going to put a piece of paper on the tip of your tongue. Go in and open. And I'm going to have you identify, close, and open again. What it tastes like.
Perfume.
Okay. I have here a few more. Okay. Now I'm going to put it on the right side of your tongue. Go ahead and close. What does that taste like?
I don't know.
I'm going to place this on the left side of your tongue. I'm just going to use two. Okay, go ahead and open it for me. And close. What does that taste like?
Like citrus.
Okay. Alright, this is the last one, I promise. Okay, go ahead and open. Close. And what does that taste like?
Bitter.
Okay. I'm going to go ahead and check a patency of the nares. So I'm going to cover one on the right side. Go ahead and try to breathe in, breathe out through your nose. Good. And we'll do the same thing on the other side. Breathe in, breathe out. Good. Okay. Now I'm going to give you a few smells. So first I'm going to have you describe it in one word and then try to identify what it smells like. Can you do that for me?
Yes.
Okay.
It's like an herb.
Okay, let's try one more. So try to describe it in one word and then to pinpoint to what it smells like.
Flowers.
And how would you describe it?
Soft. Refreshing.
And are you able to pinpoint to what it could be?
Like lemongrass.
Okay.
Strong.
And does it
Garlic.
garlic? Okay. Looking for any pulsations, changes in movement. Looking for any abnormal growths. I'm not seeing any redness. Good circulation. Good. Okay. Go ahead and tell me if you feel this on the left or right.
Right. Left. Right.
Go ahead and tell me if you feel this equally on both sides.
Yes. Yes. Yes.
Okay. Going to take a look at your scalp now. Taking a look at the scalp, just want to see if I notice any type of bruising. Noticing a little bit of the crown. It does seem like there is a hemangioma. Doesn't seem to extend too much. I'm going to do a few tests here to check for any sensory deficit. Go ahead and tell me how many times you feel the stab.
3. 2. 1. 3. 3. 2. 1.
Okay, go ahead and tell me if you feel this cold or warm.
Cold. 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 Cold.
And tell me if you feel this sharp or dull.
Dull. Sharp. Sharp.
Does this feel sharp all the way?
Yes.
Okay, do you feel this on the left or right of your hair parting?
Left. Right. Left. Right.
Okay. Go ahead and turn your head a little bit towards the right. Perfect. Any pain as I'm pressing down here?
No.
Okay. going to go ahead and examine your back now. Okay, nice. I'm going to go ahead and first listen to your long sounds on the back. To start by palpating your cervical spine. Looking for discolorations, bruising, petechiae, which could be described as pinpoint small red dots. We're looking for inflammation around the spine. Noticing some redness. It could indicate a lack of oxygenation in the thoracic area. It definitely slows down as we're moving downwards. Looking for any fluid buildup. Taking measurements to check for asymmetry. Going to apply electrodes around the bony prominences, and around them I'm going to do sensory tests to see exactly how well your spine responds to certain stimuli. ahead and tell me if you feel this on the left or right of your spine.
Right. Left. Right. Left.
Okay. Do you feel that on the left or right?
The right.
Okay.
Left. Right. Right. Right.
Okay. I'm going to apply a sensory gel. So I'm starting first with the right side. Go ahead and tell me, what shape do you think I'm drawing? Good. What about now? Good. I'm just going to make it a little bit more difficult. And that's okay if you don't get it right. What about now?
Heart.
Okay. So this is an oval. The last one.
A poultry.
It's a rectangle. Okay. No worries. I'm gonna go ahead and wipe that. Okay. And I'll do the same thing on the left side. Go ahead and tell me what letter I'm drawing. Say that again.
B.
B. Okay. What about now? Perfect. Okay. And what about now? So again.
Hi.
One. Okay, now. Okay. And the last one. This one is a little bit more difficult. Okay. I'm gonna have you stand up and we're going to talk about the treatment plan and what we can do today. All right, Anais, you did exhibit some of the symptoms of ADHD, so I would say that I want to refer you to a psychiatrist so that they can do a proper evaluation, since I'm a family practitioner and I don't want to mingle and cause any issues. So I want to make sure that you get the proper diagnosis for that. In the meanwhile, we can definitely prescribe a medication that is non-stimulant so that it does help you with your concentration level until you get that referral for psychiatry, okay?
Okay.
And if you have any questions, just let us know. With the bruising, I did notice a few, but I'm not too worried. And I'm going to go ahead and just do a lab work.
Okay.
We'll see how that looks and go from there.
Okay, thank you.
You're welcome. All right. Do you have any questions for me before I step out?
No, thanks.
All right. It was very nice to meet you
Nice to
again.
meet you also. Take care.
Okay, Casey. I'm going to put gloves on and take a look at your face and scalp. You said you were experiencing a little bit of swelling behind the ears. Just want to make sure and see if it comes from the face. So what I'm going to do is I'll first slowly palpate and look for any swelling or fluid buildup.
Okay.
Taking a look at the forehead first. I'm not noticing any redness. Skin looks clear. Trying to look for any skin growths. Something that would indicate the reason why you're experiencing the redness. Since the skin of the scalp is interconnected with the face, we want to make sure that we're covering both parts. Slight the redness on the nose. This could indicate a lack of oxygenation. Also assessing the décolleté area. Just gonna have you turn your head towards the right. And we're taking a look at the hairline. Assessing each hair follicle and looking for gland oils. You mentioned that you're having some redness and swelling behind the ear. When did that start?
Started about 2 weeks ago.
Okay, scalp area is definitely a little bit more swollen as we're approaching the ear. I'm not noticing any papules or vesicles. I'm not noticing any dry patches or alopecia. Seems like there is normal hair distribution. Have it turn towards me now. Noticing a scar here on the side and slight beginning of hair loss. Okay, I'm going to go ahead and take a sample of that. First, I'm going to apply an anti-inflammatory oil at the base. It's just going to scrub off the cells that are superficial. And now we're going to insert the sample in the enzyme package. I'm going to apply an anti-inflammatory balm that helps with healing. Okay, I'm gonna have you turn now. Right. going to focus on the first half. Okay. Go ahead and tell me if you feel this 1 or 2 or 3 puffs of air.
1, 1, 2, 1, 2, 2, 1, 2, 1, 2, 3, 1, 1, 1, 1.
Okay. What I'm going to do is I will apply a treatment along the hairline. So this is going to feel a little bit wet. Go ahead and tell me if you feel this cold or warm.
Warm. Warm. Warm. Warm. Cold. Cold. Warm. 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 Warm.
Okay, there's definitely a sensory problem here, and what we could do is to apply a treatment that lowers the swelling, and that will definitely increase blood flow. This has anti-inflammatory oils. They're very potent, so we're going to apply just a few drops on the part that we need to treat. And we're going to distribute it evenly along the scalp. Make sure that it is absorbed and all the enzymes are being transferred. Go ahead and tell me if you feel this on the left or right of the part.
Right. 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 Left. Left. Right. 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 Alright, so you're going to feel something a little bit cold. This is a treatment, helps to lower inflammation. And according to how it looks, I think this is the best that we can offer. It helps to balance pH. and to restore the normal flora. Go ahead and tell me if you feel this 1 or 2.
2, 2, 1, 2, 2, 2, 2, 1.
Okay. So as we go up on the scalp, it definitely feels like it's normal, and I'm not seeing anything concerning. I'm gonna go ahead and check your right side. Go ahead and tell me if you feel this sharp or dull.
Dull.
Does this feel dull all the way?
Yes.
The same thing. Go ahead and tell me if you feel this sharp or dull.
Sharp.
And does this feel sharp all the way?
Yes.
Okay. Do you feel this sharp on the left or right of the part?
right, 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 right.
Okay. I'm going to apply a gold serum. It will help to bring down inflammation and redness. We want to make sure that it goes a little bit on the hair follicle and on the first inch of the hair growth, also on the scalp, and that we're massaging it properly. really good. I'm not seeing any more swelling as we're going up. Using a little bit of gua sha therapy to bring down any swelling that we have in the neck. It also helps to tonify the muscles and increase circulation. Definitely looks a little bit better. We did an anti-inflammatory treatment on the scalp and neck muscles. We did focus a little bit more on the scalp, and that usually helps to bring down the redness, and you're going to experience definitely less itching, and it's going to feel very fresh and hydrated.
Okay, I'm going to go ahead and put your hair up. And I'm going to start by applying a lip balm. I want to make sure that we have our lips hydrated. Go ahead and open your lips a little bit. Thank you. I'm going to apply a crystallized serum. It helps to hydrate. And then I'm going to do a treatment. So I'm just going to apply a little bit on each cheek and forehead. Okay, how does that feel? Is it very cold?
Not very cool, it just feels refreshing. Yeah, I tend to get very dry skin lately.
Especially during the winter, it's very common. I'm going to apply cold therapy under the eyes. This helps to reduce swelling and dark circles. It also helps to stimulate blood flow to the facial muscles. And also the forehead. Sometimes frowning can cause a lot of tightness in this area, so I'm going to massage it. Okay. I'm going to use a gua sha to stimulate some blood flow in the masseter muscles. This really helps the skin to become tighter, decrease any wrinkles, especially around the mouth and under the chin. I like to do this treatment every time I apply makeup. And this usually helps with lymphatic drainage. I'm going to go ahead and color match the foundation that we're going to use today. I have two finishes, one is matte, one is glowy, so we're going to see exactly which one will help us reach the goal that we want to accomplish today with the makeup. Okay, I'm going to start with the first sample. Okay. So the first two were the matte ones, and now I'm applying the glowy. Just going to go ahead and blend them in. And we're trying to achieve a very natural look. I'm going to go ahead and wipe them. I think we did find the right foundation. I'm going to use the foundation from Makeup Forever. It has SPF 30 included. And the color that we're using today is Gold Paloma. So I'm going to go very gentle and light. Go ahead and turn your head a little bit this way. Good. cover kind of a little bit of the redness that you have on the cheeks. And we want to make sure that we're not leaving any lines, that we're blending in properly. You do have a few spots around the chin that I want to cover. And wanted to start slow and to make sure that your face doesn't have a reaction. Okay, now I'm going to apply foundation on the other side. I like to use a tapping motion to make sure that we're blending it properly. And then we're going to go ahead with the concealer. Very gentle around the eyes. I'm going to make sure that it goes all the way down to the neckline, so that we don't leave a shadow. Okay, I think this looks Very good. And now we're going to apply concealer. So I do a little bit under the eye, on the side, and above. And now we're going to blend it in. Okay, now this is my favorite part. We're going right under the cheekbone on each side. I think we do need a little bit more. Okay. Okay, that looks gorgeous. Now, final touch is the cheek tint. I'm going to use a light pink. I usually like to start with a low amount and increase from there, depending on how it blends in with the skin. Each person is unique and not everybody needs the same amount. Okay, now we're going to start with the eyebrows and move down. Perfect. And this is a natural brown gel. And we're going to use two colors for the eyeshadow. Okay, I'm going to start with a medium light pink color. That's going to be the base. And we're going to go with a dark brown just to give it some dimension. We're starting at the base of the eye and then going slowly inward, following the lines. Okay, first I'm going to use liquid eyeliner. Okay, turn your head a little bit towards me. Perfect. Okay, now I'm gonna have you open your eyes. One trick that I like to do is to apply a little bit under the lid, the upper lid. Is that okay? Okay, so I'm just going to slowly raise your eyelid. There you go. Eye as well. Okay, blink. How is it? Okay, just want to make sure that they are equal. I have to apply a little bit more here. Okay, that's better. Okay, go ahead and keep your eyes closed for me. Just going to curl your eyelashes, making sure that we're giving them the right shape. And I'm using Too Faced mascara. I'm going to use a lot of volume and definition. Okay, go ahead and look down a little bit. That's perfect. Keep your eyes closed. That's perfect. Open them. Good. Okay, and lastly, I'm going to use a nude lip gloss to give your lips a little bit of shine. Okay. And this is the final look. Go ahead and tell me if you would like me to fix anything, apply a little bit more.
It's great. It looks very natural. So, yeah, I really like it.
I'm glad. Alright, and I think the color of the foundation really matches your skin tone.
Yeah.
It's like you're not wearing anything.
Yeah, it's very light.
Thank you. You're welcome. Hi, Katie.
Hi.
Welcome back. My name is Dr. Matt. I'm going to do your exam.
Okay.
So, let's see. I have here your file. Can you please verify your date of birth?
Sure, it's March 23rd, 1989.
Perfect. So go ahead and tell me what's going on.
I've been having some stomach pain lately, just like a lot of tenderness and soreness, especially near the belly button, kind of in the middle area.
Okay.
I don't know what it is. Sometimes it gets a little red too, like it isn't today, but a few days ago it turned red for a few hours. And also I'm having back pain, just like in my midsection of the back, kind of on either side of the spine. Just a lot of tension, and I don't know if that's related or not, so that's why I'm here.
Okay. I can definitely take a look and see exactly what's going on and try to find the cause of it.
Okay.
Okay. How would you rate your back pain on a scale of 0 to 10?
I would say it's about 6 or 7.
It's pretty intense. Have you
Yeah.
been taking any pain medicine?
Ibuprofen.
And for the stomach pain, you said it's around the belly button.
Yes.
Have you been taking any medicine?
No, not for that. I'm just not sure what I would take. It's just like a soreness that won't go away.
And is this the first time that you're being seen for this issue?
Yes. Yeah.
Okay. Are you taking any medicine on a daily basis?
Yes, I'm weaning off of Wellbutrin, so I'm taking only like 25 milligrams a day, which is a really low dose, and trazodone at night to sleep.
Okay. Just in case we need to prescribe any medication to make sure that it doesn't interact with what you're already taking. Perfect. Okay. Okay, I'm just going to go ahead and put gloves on. And how would you describe your abdominal pain? Is it sharp or dull?
It's dull. Yeah.
On a scale of 0 to 10, how would you rate it?
It would be about an 8 if you press on it. Yeah.
Okay, I'm going to put this on your index finger. Go ahead and relax. And we'll wrap this around your upper arm. Okay, I'm going to have you uncross your legs. This is going to feel a little bit cold. Okay, blood pressure is a little bit elevated, so we're going to make sure that we have that in your medical records. Heart rate looked normal and oxygenation is good.
Okay.
So I'm going to keep an eye on it. We want to make sure that if it is an infection, we treat it properly with a broad spectrum antibiotics.
Okay.
But first, I'm going to need to take a look and see exactly what we're dealing with to see if there is any fluid that we could test.
Ooh, okay.
Blood pressure was 135/60. Systolic a little bit elevated. Heart rate was 70 normal. And then oxygenation was 95% on our layer. That's also normal. Alright, let's go ahead and take your temperature. Alright, this will go on your forehead, so go ahead and relax. 96.6. That's a very good sign.
Okay.
Did you take any ibuprofen before coming in?
I did, yeah.
You did?
Yeah.
Okay. Then the ibuprofen might mask any temperature spike if you are having any. Did you experience any flu-like symptoms?
No, I haven't. I haven't felt feverish or chills, nothing like that.
Okay. I'm going to have you lay down and I'll take a look at your stomach to see and your abdomen to see if there is anything concerning, okay?
Sure.
All right. Okay, Katie, is it okay if I lift the shirt up a little bit?
Yeah, go ahead.
And do you mind if I unbutton the pants?
Not at all. Go ahead.
Okay. Let me go ahead and take a light here. I'm definitely noticing a little bit of redness around it. Some swelling. So how long ago did you notice the redness around the belly button?
That happened like 3 days ago. Yeah.
I'm going to listen on the stethoscope. This is going to feel a little bit cold. I would say definitely diminished sounds, especially in the center of the abdomen. And before I palpate, I'm just going to go ahead and take a sample.
Okay.
So what we're going to do is we're going to sample and culture it to see exactly what kind of bacteria we're dealing with. And also I'm going to check for any fungal infection. going to take a few measurements here. We're looking for inflammation. I want to make sure that all 4 quadrants are symmetric. Going to feel kind of like a pinching sensation. We're looking for hydration status. Okay. So now I'm going to go ahead and check your back. Okay, Goody, I'm going to go ahead and put your hair up so that we can take a look at your back. Okay, before I start palpating, I'm just going to go ahead and listen. This is going to feel a little bit cold. Okay, everything sounds good. I'm going to go ahead and percuss. Going to palpate. We're looking for any swelling. Checking for spine misalignment. I'm not sensing any signs of scoliosis. We're looking at shoulder alignment. Just a deeper palpation here. We're checking for deep infection. Let me know if you feel any kind of pain as I'm palpating. I'm going to take some measurements. This is going to feel a little bit cold. There's definitely some inflammation at the base of the lungs. Although it does look like it's muscular, I don't think it's originating from the belly button, so they might be just two different issues. I'm going to touch you on left or right of your back. Go ahead and tell me if you feel this on the left or right.
Right. Right. Left. 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 Right. 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 Left. Right.
And now I'm going to touch you with a different texture. Go ahead and tell me if you feel this warm or cold.
Cold. Warm. Warm. Cold. Warm. Cold. 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 Warm. 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 Cold. Cold. Warm. Cold.
And now I'm going to touch you with a warm and a dull object. I'm going to need you to tell me if you feel this warm or dull.
Dull. Warm. Warm. Dull. Dull. Dull.
And I'm going to introduce cold as well at some point, so go ahead and tell me if you feel this cold, warm, or dull sensation.
Sure. Dull. Cold. Warm. Dull. Cold. Dull. Dull. Warm. Dull. Cold. Warm. Dull. Dull. Cold. Dull. Cold.
And now I'm going to introduce a fourth object, which is going to feel kind of like a sharp sensation. This is what it's going to feel like. So go ahead and tell me if you feel this cold, warm, sharp, or dull.
Okay. Dull. Cold. Sharp. Warm. Warm. Sharp. Dull. Sharp.
there's definitely a sensory problem. What we could do is to take a sample of the skin here as well and to see if it matches the same bacteria or, flora that's growing on the abdomen. Okay, I'm going to just take one more sample here. We're going to send this to the lab.
Okay.
Okay, this is going to feel warm. And first I'm going to start with a sensory brush. It's going to help to reduce inflammation. You use cupping therapy. This is going to help to stimulate blood flow. I'm going to apply some acupressure therapy around the paraspinal muscles. This will help decrease inflammation in the area and activate the lymphatic drainage. also going to use a gua sha to help release the toxins from the soft tissue. Okay, I'm gonna have you get dressed and we're going to talk about what other tests we should do, okay? Okay. Alright, Katie, I'm just going to go ahead and remove my gloves. And I would like to order an MRI for you.
Okay.
Alright, so we're gonna do an MRI of the abdomen and back, just to double check for any infection and to see if we need to order any antibiotics, okay?
Okay, alright. Sounds good.
And are you allergic to anything?
Not that I'm aware of, no.
Okay, so we're gonna do an MRI. And if we can't find the source through the MRI, then maybe we're gonna go with a CT scan with contrast.
Okay.
As soon as I have the blood culture ready, I will send you an email and we're going to start a course of antibiotics. I just don't want to start it right away. I want to make sure that we are targeting the right bacteria.
Infection. Okay. All right.
Do you have any questions for me?
No, not at this time, but you've been really helpful, so thank you.
You're welcome.
Yeah.
I'll see you soon.
All right. Bye.
Bye.